Hi, I'm Dr. Neil Beck in Perth, Western Australia. I'm sorry, I'm just having a little bit of difficulty with the technology. I'll be with you soon. Yes, a bit of trouble with the technology. Technology is not my strength. I'm an old man. As a doctor in Perth for 53 years, I had 500,000 consultations, home and hospital visits, helped to bring 800 babies into the world, did a lot of tonsillectomies and appendicectomies and vasectomies and broken bones, and treated a lot of pneumonia and all sorts of things, but don't know a lot about technology. So I'm not sure. Normally we're connected to TikTok, to Facebook, to Instagram and to YouTube Shorts, but I'm not sure what I'm connected to now. So as a doctor in Perth for 53 years, starting working in the hospitals, then for many years a family doctor, a suburban family doctor, and then for 5 years having my own addiction clinic. The conclusion I came to was that the biggest problem people had, the biggest problem the world faced, was mental health problems. And mental health problems were managed so badly that many troubled people ended up not getting diagnosis and proper treatment, then getting relief from street treatment, and the street treatment was always addictive, so they ended up as being addicts. And in the late 1990s we had a terrible epidemic of heroin addiction, and I thought I'd better find out about heroin because I knew nothing about it, and I started to work 10 hours a week in an addiction clinic. One day I saw 15 heroin addicts, and 5 of them had ADD, ADHD, which was not diagnosed and not treated, and they were in a terrible condition. And then I realized that I needed to look for other mental health problems, and I found there were about 10 common ones. The commonest was worry anxiety disorders, including general anxiety, social phobia, panic attacks, obsessive compulsive disorder, and various phobias. Another one was sleep disorders. A lot of people with addiction problems had terrible problems with sleep, and if they didn't get that properly diagnosed and treated, then they took street drugs to help them sleep and became addicts. The third thing was major depression. Then there was bipolar disorder, highs and lows, and then there was ADD, ADHD, then post-traumatic stress disorder, then one that I called IAD, which was irritability, anger, violence disorder, one I called PTEF, post-traumatic evil focus, where people had such terrible things happen to them that they couldn't cope with them, and they diverted their attention by focusing on faraway problems that other people had, such as conspiracy theories and the CIA and Guantanamo Bay. But doing that gave pretty bad results, because they ended up obsessing about these terrible problems in other parts of the world, and more of the people they interacted with were also people obsessed with faraway problems, and they never got to fix their big problems, and it was a disaster. Then there was schizophrenia. Then there was very, very low self-esteem. A lot of these people had been born in very poor circumstances and raised in very poor circumstances, and had a big chip on their shoulder, very low self-esteem, which caused them to suffer, and if they didn't get diagnosed and treated properly, then they ended up on street drugs and became an addict. Then there was autism. So what I found was that 95% of my addiction patients had serious mental health disorders, which had driven them to, in desperation, to taking street drugs to get relief, because they didn't get proper diagnosis and treatment. And then I realized that what they needed was what we call dual diagnosis. Dual diagnosis is having their mental health problems diagnosed and treated at the same time as their addiction was treated, and that worked so much better. But nobody else was doing dual diagnosis treatment at that time. I'm very happy to say that now lots of clinics are doing dual diagnosis, but that dual diagnosis is what every addict needs. If you don't find and fix their underlying mental health disorders, it's very much harder to get them off their addiction, and they're very likely to relapse if the original cause is not found and not fixed. And people with addictions didn't just have one mental health problem, they usually had 2, 3 or 4 mental health problems. I can still picture a woman I saw who had 5 serious mental health disorders. But what was happening is that people were not getting better, and because they were not getting dual diagnosis treatment and having a mental health diagnosis and proper treatment for it, they just were given addictive medicines. Methadone was the big one. Methadone, discovered in 1938 by the Nazis, still the main treatment for heroin addiction in the 1997, 98, 99. And because the clinic I was working 10 hours a week in wasn't interested in causes, I couldn't find any mental health clinic in Perth or Sydney. I went to all of them, and no one knew what the cause of addiction was or thought that they should know. But when I did dual diagnosis treatment, it worked far, far better. But that got me into all sorts of trouble, because the big government clinic, the big health department clinic, addiction clinic, which did no mental health, had a waiting list of 2 months, their clinic was full of people coming back for repeats of methadone. And so if a new patient came and said, I've got a heroin problem, I'd say, oh, come back in 8 weeks, and give them an appointment in 8 weeks. But once I was doing dual diagnosis treatment, the word spread, and lots of people came because they wanted to get their mental health problems treated as well as their addiction. And it worked so well that gradually the big 6-doctor public health clinics 8-week waiting list started to shrink. People weren't coming back. They were getting fixed by dual diagnosis. And so that big clinic's 8 weeks waiting list got smaller and smaller and smaller until in the end they had no waiting lists, and they were worried about their jobs. So they just wrote me a letter and said, you aren't following our guidelines, which of course I wasn't. No way I was going to work the way they worked. Everything I did was legal, it was sensible, it was just common sense, good practice. But they said I wasn't following their guidelines, so I could no longer treat addiction patients. So my clinic had to be closed, my addiction clinic. And why? What was the problem? The problem was that mental health care was so weak and so repetitive, and so many people coming back again and again and again and never having their problem solved, that there was never going to be enough mental health care workers to do all the work to help all the people who needed mental health care. And why was mental health care so weak? Pathetically weak, embarrassingly weak. Well, first of all, they only had 2 tools. Both those tools, mental health and addiction tools, had great weaknesses. The first tool was medicines. Medicines had this great problem that the people who needed help from medicine wanted medicine that worked quickly, they got better and they stopped taking the medicine. But the people making medicine wanted them to stay on medicine, as much medicine as possible, for as long as possible, if possible for the rest of their life. So what did they do? They made many of the medicines addictive, as many medicines addictive as they could get away with. So the commonest problem, worry, anxiety problems, all the treatments, all the medicines for worry, anxiety were addictive. Originally it was the barbiturates. There were many different barbiturates and they were all addictive. And then in the mid-60s we got the benzodiazepines, many different benzodiazepines, all addictive. Valium, Seropax, Mogadon, Xanax, all addictive. The other weakness of the medicines was they were too slow. They were all tablets and capsules, and when you swallow a tablet or capsule, it takes half an hour to an hour to go right down your gut before it starts to get into your bloodstream and starts to help you, and it's 1 to 2 hours before it's working strongly. And that's just too slow if you're trying not to have a smoke, if you're trying not to buy a bottle of scotch and drink it all at once, or if you're trying to avoid taking heroin, or trying to avoid taking ice or crystal meth. So the medicines were too slow. And the other tool was talk therapy, counseling, psychotherapy, CBT, whatever you like to call it, but talk therapy. And talk therapy had two big weaknesses. One was it was too slow. When you saw a new patient with talk therapy, you needed an hour. You needed an hour to talk about what their problems were, how they started, what caused them, what kept them going, and what might help them to stop their mental health problem. Took an hour, too slow. And then after that first hour, they had to come back every week for half an hour, three-quarters of an hour, or an hour for more talk therapy. Just too slow. And the other problem, big problem with talk therapy, it was too expensive. To be a therapist, you had to be a highly qualified person. You at least needed a 4-year Bachelor of Psychology degree from a university, and a lot of psychologists had a 6 or 7-year PhD degree. And to be a psychiatrist, you had to do a 6-year general medical degree, some general medical practice, and then a 3, 4, or 5-year postgraduate psychiatry degree. So those people with therapists were very intelligent people with long, expensive training, and they needed to be paid well. And if we didn't pay them well, they might do something else, and we'd be even shorter of mental health care workers. So mental health care was very weak because there were only 2 tools, and those tools both had very big weaknesses. And mental health care was very ineffective because there were about 8 big blind areas, important areas in mental health that the mental health care system didn't treat. They were blind to these very important things. First of all, causes. They would treat your bad feelings, your depression, your anxiety, whatever, with medicine, but they didn't find the cause. And if they didn't find the cause, the problem just went on and on and on. So and that created waiting lists, which caused problems. On waiting lists, people suffered horribly. Some went to hospital, some became dealers and went to prison, some went to a cemetery. But it was essential to find causes, and mental health care was weak because they didn't look for causes. They didn't think that causes were important. They didn't know what the causes were. Secondly, mental health care was weak because they treated people as if they were solo, and nobody is solo. The most important thing in our life is our family. Even if our family is split and broken up and we have nothing to do with other members of the family, that was still the most important thing in our whole life. That's what caused so much of the mental health disorders. If a mentally healthy sick person was treated and nothing was done to help them understand their family, they just went on and on and on. They didn't get better. The third thing was they ignored transgenerational traumas. Transgenerational traumas are very important. A lot of mental health problems are due to the fact that the mother or the father had a big problem, or their mother or father had a big problem, or their mother's mother or father had a big problem. A lot of problems started in the great-grandparents or the grandparents or the parents, and those problems affected the children. But my family had serious mental health problems because of a great-grandmother, and I, as a doctor for 53 years and all the study I did, all the reading and so on, I never heard about transgenerational trauma and until a few months ago. My great-grandmother had her first baby when she was 16. By the time she was 22, she had 4 sons. Then her husband deserted her. He had an alcohol problem. And then she had 2 daughters with a boyfriend, which she never actually married. And then she married again and had another 3 children. When she was 30, she married again and she had 2 babies 10 months apart, and then another baby. And then she died when she was 42 from cancer because she had so much stress that her immune system was depressed, and that allowed her some part of her body, we don't know which, to go crazy with cancer that killed her when she was 42. And her 5th child, her daughter, first daughter, who was 6 when she married again, was probably about 14 or 15 when she got cancer, and 18 when she died, had to do so much of childcare and work and so on that affected her badly, which passed the problems on down through the family. So mental health care was weak because one of the major problems, transgenerational trauma, was ignored. The 4th weakness, blind area, was habits. 60 to 65% of our life is habits. Our brain has to do so much that anything that we repeat over and over and over again, it turns into a habit, which then happens automatically without conscious effort or work. So the brain can focus on the really difficult things and on the new things, on the things that are changing, and everything that's routine and happens over and over again, whether it's helpful or harmful, gets turned into a habit. And once it's a habit, it just happens. The triggers and the messages that cause it just go on and on, and it's very hard to stop it. And 60 to 65% of our life is habits. 60 to 65% of our life, including sleep, is habits. And mental health care just ignored habits. One of the most important things in coping with mental health disorders is to learn how to make new good habits and how to break harmful old habits. But they just ignored habits. And the 5th blind area, in my opinion, is that what people need to know most is, when they've got mental health problems and especially addiction problems, what they need to most know is what they want and need. But we don't tell them or emphasize to them what they want and need. We just tell them, oh, you've got this disease, or you've got that disease, or you've got ADD, ADHD, or you've got major depression, or you've got bipolar, or whatever. What they really need to know is, I mean, I think it's good if they know that they've got ADD, ADHD, but what they really need to know is what they want and need is to be able to focus and concentrate well, and to not be impulsive so they can make good decisions. Because ADD is mainly there are a number of problems, but the main problems is that people with ADD, ADHD have great difficulty focusing and concentrating, and they're very impulsive, so they make bad decisions, impulsive decisions. They're sitting ducks for the drug dealers. The drug dealers only have to say, oh, this would help you, and bang, they take it. Even if their best friend just died from that drug, they're impulsive, they take it. And then a lot of them are very hyperactive. We need to help people to know what they want, need, so they can go for it. If they know that what they really need to do is to focus and concentrate better and not be impulsive, they can think about that, they can focus on it, they can notice other people who do that or don't do that, and that motivation of knowing what they want and need is a great help in getting them better. But mental health just ignores wants, needs. And mental health is weak also because we don't teach people to help themselves. There's only the mental health disorder problem is only ever going to be fixed if people can learn to do as much as possible for themselves. Well, we treat them all as idiots. They don't know what to do. Just give them a prescription or talk to them, and they've got that mixed up and forgotten when they walk out the door. No, we have to teach people to do self-help. And another great blind area is that mental health problems need to be fixed as early as possible. A mental health problem leads to more mental health problems, leads to more mental health problems and complications until it becomes so complex that it's almost impossible to fix, and those people need 10 or 20 times more help, which makes the waiting list longer and longer. So if as soon as a problem happens, as soon as you crash the car and get a broken leg, you need to start to deal with the mental health issues. As soon as your wife tells you that she's leaving and the family falls apart, that problem needs to be dealt with early. The earlier you deal with problems, the simpler they are, the more obvious the causes are, the more obvious what you should do to get better is. And yeah, mental health care usually comes 5, 10 or 20 years after the problem started, when it's very complex. And another blind area, in my opinion, is that far too much emphasis is placed on blame. A lot of mental health care is, who's to blame? Oh, was it your mother? Was it your father? Was it, yeah, who's to blame? What happens is, if somebody hurts you or neglects you, and you locate that person and you blame them and you fight about it and you won't talk to them, it just makes it all worse. When nearly always the person who hurt or neglected you did that because they were hurt or neglected, and the person who hurt or neglected them was hurt or neglected. So in a sense they were to blame, but in a sense they weren't to blame. You know, that there are no perfect mothers, no perfect fathers, no perfect families, no perfect homes, no perfect neighborhoods, and no perfect schools. So every child starts life with some damage. Every one of us. No perfect mothers, no perfect fathers, no perfect homes. We all had some neglect and some distress and had some mental health problems developed in childhood. Even before we were born, when we were in our mum's tummy, our nutrition came from her blood supply. But what other things did she have in her blood? Was she an alcoholic? Was she a heroin addict? Did she have major depression? Did she have ADD? So even before we were born, we were having problems. And the first year of our life was the most important year of our life, because in the first year of the life we lay the foundation of the two most important things in the whole of our life. The two most important things in the whole of our life are our feeling habits, our emotional habits. Did we mostly smile and we were mostly happy, or did we do a lot of sadness, loneliness, even irritability, anger because of neglect or problems? Because our mother was inexperienced. You were her first baby. She didn't know exactly what you needed when you cried, so you suffered. In my practice, when a mother got to her third baby, she would say to me, "Oh, it's perfect. You just wouldn't know it's in the house. Just eats and sleeps, eats and sleeps." And she thought she had a perfect baby, but I knew what really was the case was that baby had a perfect mother. And why was she a good mother? She was a good mother because you learned on the first child and the second child, and by the time she got to the third child, she knew what they wanted as soon as they cried. They were helpless, and they needed her help for so many things, and she knew what to do and did it quickly and did it efficiently. So the blame game is very harmful, and it appears to me that mental health care industry does not recognize how important it is to know exactly what happened and exactly why it happened. That is exactly why the damage, the suffering happened, and exactly why it happened, and not who to blame, because whoever we decide to blame, they usually were neglectful or hurtful because they'd been neglected and hurted. It was a family problem. It was a transgenerational problem. So what was the solution? Over 27 years, I developed 7 effective mental health and addiction tools, and I've got another 3 coming. And I have no doubt that when I've got those 10 all finished, there'll be more. But the tools were videos. When I got very busy, I couldn't spend half an hour with every patient doing talk therapy and explaining everything to them. And there's no faster, easier, better, lower cost way of understanding your mental health problem and starting to fix it than to see the right video on it. Video is so important. Except I made one mistake. When my first video about 14 years ago was, I think, about 10 or 12 minutes, and I got it got 10,000 viewings in 9 months, which was considered to be very good. So I thought I knew what I was doing, so I made another 8. But then less and less people watch those videos. So, oh, I got to do them again and do them better. So I made 31 videos, spend a lot of time getting the text exactly right, and hardly, 200 people looked at that video. And then I found that I had to make under a minute videos because everybody was watching, no, not everybody, 90% of people were watching TikTok under a minute videos. So now I've got about 90 under a minute videos which cover all the main problems in mental health and addiction, only one at a time. You can only deal with one problem in a minute, and to do that you have to spend a lot of time getting the text word perfect. As Sir Winston Churchill said, he made a long speech because he didn't have time to prepare a short speech. And the shorter the video is, the harder it is, because it's got to be word perfect. Can't have any spare unnecessary words in it. And the second tool was websites, so that people could go to the website and read up about this or that or whatever their problem was. And I struck the same problem with that. My main website was, and it's still there, mentalhealthvideos.a-to-z.com, mentalhealthvideos.a-to-z.com, but it was too long and detailed, so then I had to make a short website. So my new website is smilefixit.com, smilefixit.com, and we're just revising it at the moment because everything has to be revised as you get feedback from people. They make comments, they ask questions, they send us criticisms, and we welcome that. You can only get things better and better and better by getting feedback from your consumers. The Smile Fix It website, it's got everything on one page, and you just look at it and you see what you want and you tap it, the link, and that takes you to more detail about the problem that you've got. The third tool was an app. When I got very busy, I made a checklist, and one of my assistants would do the checklist with a new patient, and that would save me a lot of time because I just read the checklist result and talk to the patient for 5 minutes, 10 minutes instead of half an hour. But checklists meant that people had to come to the surgery, they had to have appointments, and there had to be another person, and in the end we knew that we had to have an app. Apps are a lot of work and they cost a lot of money, but we've now got the Mental Fix It app, which is free. You can go to on your phone to the App Store or Google Play, tap on it and download the free Mental Fix It app in a few seconds. And that was too long to begin with. It was 38 questions, which took people about 10 minutes to do. Each question had, most questions had 3 alternative answers, and you just had to find which was the answer that was nearest to you and tap that. And you can go through the 38 questions, tap, 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 in 10 minutes and get an instant report that told you the 4 things you needed. But that was too long, and several hundred people subscribed to it, but we wanted thousands or hundreds of thousands of people to be doing the app. So then we revised it from 38 questions to 19, the 19 most important questions, which they could do in 5 minutes. and that's what's up there at the moment. But we are I've spent a month, 2 months revising to make the Mental Fix It app into a 2-minute app. And I know that a lot more people will do it when it's 2 minutes instead of 5 minutes. But my tech assistant has been away for 3 months in New York doing some courses, and he just came back today. And so our first job is to bring Smile Fix It up to date, and then to bring the Mental Fix It app up to date. A lot of work to do. And the fourth tool, so that's 1, videos, 2, websites, 3, the app, 4, live streaming, which is what I'm doing now, because a lot of people love to watch live streaming. TikTok has over a billion viewers each month, and we do it on TikTok, YouTube Shorts, Instagram and Facebook. But today I had trouble with the Facebook login, and I'm sure we're on TikTok. That's pretty easy, and I think we're on YouTube Shorts, but I think we're not on Facebook or Instagram today, but we usually are. And I usually do 75 minutes, about an hour and a quarter, on Wednesday, Friday, Saturday at 7 p.m. Perth time and 9 a.m. Perth time, because 7 p.m. Perth time is 9 p.m. Sydney and Melbourne time, and that's 7 a.m. New York time and 4 a.m. Los Angeles time, and God knows what in London and Sweden and Norway, where we have other viewers. So I now do the Sunday session 9 a.m. Perth time, which is sometime in the evening, Saturday evening in the Northern Hemisphere, and sometimes up to half of our viewers are in the Northern Hemisphere, so we need to work at a more suitable time for them. But that's the fourth tool, and a very powerful tool. I usually now get between 1,000 and 2,000 viewers every time, and I can't talk to all those people. A lot of them want to talk to me, but I can't do that. I don't know how to do the technology, but I haven't got the time. There's so many people. But when I first started, I usually got 3,000 or 4,000 viewers, and once I got 4,700 viewers in one session, and once I got 8,600 viewers, another time I got 8,700 viewers, and they're still online. But that was because what I was presenting was all new. But I repeat myself a lot, because the most important things in mental health and addiction are limited, and I just have to go over them over and over again, so a lot of people stop watching once they've understood what I've got to say. The fifth tool is powder medicine. Why powder medicines? Because tablets and capsules are too slow. When you take a tablet or capsule, it takes half an hour to an hour to go right down your gut and start to work, and 1 to 2 hours to work strongly. But if you drop powder medicine on your tongue and don't swallow it, suck it, it gets into your circulation in 5 minutes. Starts to get in 5 minutes, and it's working strongly in 10 to 15 minutes. And that's much better if you're trying not to drink a bottle of scotch, or trying not to smoke, or trying not to take ice or heroin or whatever. Your tongue is pink or red because the blood vessels are so close to the surface, and if you drop thousands of tiny particles of powder medicine on your tongue, it gets into those blood vessels very quickly and starts to work in 5 minutes, and is working strongly in 10 to 15 minutes, which gives you a much better chance of delaying or reducing or stopping an addiction, or delaying or reducing or stopping panic attacks or social phobia or PTSD or irritability, anger, violence disorder. And it's even better than that, because if the powder tastes very nice, you soon get taste conditioning. Your body connects the fact that you have this lovely tasting powder medicine on your tongue, and 5 minutes you start to get better. And after a while you get taste conditioning, and then as soon as you taste the powder on your tongue, it starts to work. As soon as you drop it on your tongue and it gets to the taste buds at the back of your tongue, it starts to work. So powder medicine then starts to work in seconds, and it's working strongly in 5 to 10 minutes, which is even better for stopping mental health distress or stopping drug craving. And it's even better than that, because with powder medicine you can mix 2, 3 or 4 powder medicines together and have much more powerful effect. Because if you've got one mental health distress, you've nearly always got 3, 4, 5 or 6 mental health distresses. Sure, there's the biggest, worst one, and maybe a second big one, and the others are smaller, but they're still also adding to your mental health distress, and adding to the likelihood that you'll start to take to get relief from addictive street drugs. So one medicine doesn't fix all those problems, but if I mix 2, 3 or 4 medicines together, it helps that mental health distress, that mental health distress, and that mental health distress, and that drug craving, and that's much more powerful. So you have a much better chance of delaying the problem and reducing the problem, and eventually not doing the problem and then quitting, because that's how you break addictions. And mental health disorders are basically habits. You got worried and anxious so often that the triggers and the electrical and chemical messages that underlie the worry, anxiety got stronger and stronger and stronger until your brain turned them into a habit, because your brain's so busy that it turns everything into a habit that you do over and over and over again. Or you got angry over and over and over again until that was a habit. The trigger is very easy. The electrical and chemical messages that underlie it are strong, and it triggered, and the more often you're angry, the easier and the more often you get angry, or frightened, or lonely, or sad. So mental health disorders are basically habits. So you need medicine that stops it very quickly. And I put my powder medicine, single or combinations, in pocket powder medicines which I designed. So you've got the medicine for your problem in powder form, in a dispenser, in your pocket, and anywhere, anytime, even driving the car, you can just whiz it out and drop the powder on your tongue, and it'll be working at first in 5 minutes and before long in seconds. So the fifth tool was powder medicines. The sixth tool was powder medicine pocket dispensers. The seventh tool was the heartbeat meditation aid, and I can't see it, it's here somewhere, but my desk is a jumble. Meditation is so helpful for people with mental health disorders. Meditation is so helpful. It helps people to calm down, to relax, to get refreshed, to be stronger. And it gradually improves the epigenetics of your brain. That is, which genes are switched on and which genes are switched off. You can't change which genes you've got, but you can change which genes are active and which genes are inactive, and meditation helps with that. But the people who most benefit from meditation often can't learn to meditate, because the meditation experts who've been doing it for 5, 10, 20, 30 years, they can just start meditating like that. Anywhere, anytime, just start meditating. But you've got to learn it, because meditation is a habit, and you only make that habit by doing it often, lots of times. And sorry, I'm just going to try and find that heartbeat meditation aid. Here it is, heartbeat meditation aid. So the experts who teach meditation will focus on a word. They'll give you a word and you just repeat that word, repeat that word, and you focus on the word. And when you're focusing on that, you stop focusing on all your troubles, and then you relax and you get calm, and you get stronger and refreshed. Except that when you're very disturbed, you need something strong to focus on in order to be able to stop going back to all your worries and stresses. And a word is not a very strong mind grabber. Or they teach you to concentrate, to focus on your breathing. Breathe in, breathe out, breathe in, breathe out. Stop thinking about everything else. Have a rest, relax, calm down. Except your breathing is even more difficult to focus on than a word. So a lot of the people who most need to be able to meditate can't learn. And it's so valuable. So I've been listening to people's hearts with a stethoscope for 50 years, and I knew how loud and clear and interesting a heartbeat is. So I just shortened the stethoscope, and that's the hearing part, and it's short, so you just stick it on the upper left side of your chest, right over your heart, and you listen to your heart beating, and it beats loudly, strongly, and it's very interesting and mind-grabbing, and you can learn to meditate. And when you've been meditating, listening to your heart for a month or two, you can gradually start to learn to do it focusing on your breathing. And focusing on your breathing is the best, because breathing steadily in and out, your breathing is very closely attached to your feelings. If something bad happens, you hold your breath. So the steady breathing is very therapeutic. If you notice just before you go to sleep, you'll notice that your breathing gets very steady, in, out, and off to sleep you go. So steady breathing is very important, and that's what you should graduate to. But to get started, you may need to have a heartbeat meditation aid, and we can send you one of this anywhere in the world for $25 plus postage. And I'll tell you about the 8th tool. Where is it? What have I done with it? So here's the 8th tool. It's a bigger pocket powder medicine dispenser, which doesn't dispense medicine, it dispenses fruit powder, lovely tasting fruit powder. Fruit powder is becoming more and more popular worldwide, and you can get all sorts of fruit and vegetable powders. And fruit and vegetable powders have very little sugar in them, and it's natural sugar, it's not cane sugar, and they have fiber, and we need fiber. And so you can use the lovely taste of your favorite fruit powder or vegetable powder or whatever powder you like. I showed this to a friend who's a psychiatrist, and I love the powder that's in this, vanilla, and that's good for me, but he doesn't like sweet stuff. So of course he can put onion powder or carrot powder or whatever powder he wants in his. And what you do is, if you're trying to make a new habit, and you've got to do it over and over and over again so your brain turns it into a strong habit, but it might be something you really don't like doing very much, like exercise, or like studying, or like, so every time you think about the thing that you want to turn into a habit, or you start to do it, or both, you just give yourself a lovely taste, and you keep on doing that, and you love the taste, so it's easier for you to do the habit, and you start to get taste conditioning, and it's much easier to do the habit that you want to do but you don't like doing very much. So make habits with lovely tastes, and cheer yourself up a bit as well with your lovely taste, or break habits with lovely taste. How do you break habits? The opposite of making them. Making them, you do them over and over and over again till the triggers and the underlying electrical and chemical messages are strong. With breaking a habit, you have to break those strong triggers and habits. And people will tell you, oh, go cold turkey. I remember in the old days, AA were very big on going cold turkey. And I think Ronald Reagan's wife said, just say no. Sounds great, but very hard to do, and so many people can't do it, or they do it for 2 days and then they relapse, or they do it for 6 weeks and then something happens and they relapse. So what you have to do is you delay the habit and you do a little bit less of it, and that weakens it. And when you weaken it, you can delay it a bit longer and you can reduce it a bit more, and that weakens it more, and then you can delay it longer and reduce it more. Let's take the example of smoking tobacco. Smoking tobacco is a very strong addiction. It kills 7 million people a year in the world, and for everyone it kills, it ruins the lives and often the family, to some extent the family life. So stopping smoking is very important. One of the most important health things you can do, stop smoking. So if every time you think you want to have a cigarette, you whiz out your fruit powder dispenser and drop a lovely taste of fruit powder on your tongue, and you focus on that lovely taste, and you try not to think about the smoking. And when that lovely taste starts to fade, you take another dose and you focus for some longer. So if you can start by delaying the smoking by about 15 minutes, so you delay the smoking by focusing on the lovely tastes, and if you can delay the smoking for 15 minutes, and then when you do smoke, you smoke 3/4 of the cigarette and chuck the last quarter away, so you smoke a bit less. That weakens the craving for tobacco. Your body's chemistry starts to go back to normal because it's been screwed up by the nicotine and the carbon monoxide and whatnot in the smoke. And if you keep on doing that, within a couple of weeks you can usually very comfortably reduce your smoking by a quarter. And then you keep on doing that, and you delay a bit longer, half an hour, or 20 or 30 minutes, and you only smoke half the cigarette and then throw it away. And then you can comfortably cut your smoking by a half. And then in another couple of weeks, you keep on doing that, you cut it by 3/4. And then in 8, 10 or 12 weeks, you can just quit smoking. And if you keep your lovely powder in your pocket, you're not going to relapse. Because when you had a crisis, which you used to have a smoke to deal with, or you're in a group of friends and they're all smoking and blowing the smoke in your face, and they say, oh, here, have a cigarette, just only have one. But you only have to have one and you're gone. You're back, you're a smoker. But you say, oh no, I've got this lovely taste, I prefer this lovely taste to the tobacco. So you whiz it out and drop it on your tongue. And then they say, oh, what's that? Yeah. And you say, oh, well, you can get these. They're only about $20, and they got 45 doses of lovely taste in them, and you can smoke less. And I say, oh, well, my wife wants me to stop smoking, or my doctor wants me to stop smoking. Oh, I don't want my kids to smoke, so I better do that. So it spreads. So that's tool number 8, pocket powder medicine. Tool number 9, I better not tell you about it. And tool number 10, because I've got a lot of work to do, but they're going to be the most powerful tools of all. And I hope that effective tools for mental health that people can help themselves with and can start as soon as they've got a problem while it's comparatively easy. I hope that's going to change it all. And because we've got the internet and laptops and phones and stuff, it's possible it'll go global. That's what I'm hoping for. My goal is for someone who has a problem, crashes the car, has a big row with their wife who leaves, one of their kids breaks their leg, or whatever, so they're in trouble. They whiz their phone out, they tap the App Store or the Google Play button and download the free Mental Fix It Up in a few seconds. And then now to do the Mental Fix It Up takes 5 minutes. Soon it'll be 2 minutes. And the Mental Fix It Up tells them which 6 1-minute videos will help their particular problems most. The app gives an instant report, and the instant report says, watch these 6 videos which will help your problems most. So in 10 minutes, download the app, do the check, watch the 6 videos, you're miles in front. Well, that's what I hope. Anyway, that's enough for today. What today? Today is Wednesday, so I'll be back again here 7 o'clock Friday and Saturday Perth time, and 9 AM Perth time on Sunday. I'm sorry I can't talk to everyone, but I'm very interested in your feedback, so please, on whatever platform you watch, send us comments, questions and criticisms, how we could do things better, or you send it to us with an email. The email for this is healthestuff@gmail.com, spelt the way I said it, healthestuff@gmail.com. If you can't remember that, hopefully you can remember smilefixit.com, and on the smilefixit.com you'll find our email address, and send us your comments, your questions, your criticisms. And I always, after I've done the session, go through all of those, the new followers, the likes, the comments, the questions, and answer them, and then a lot come in overnight, and I do that again in the morning. So I try to respond to as many people as I can. Some I can't respond to because the message doesn't go through if they're not followers. But yeah, so that's that. So that's enough for an old man. So we'll stop now, and be back again on Friday at 7 PM